Now, more of the WBAL News Radio Town Hall Special, the coronavirus. This is WBAL News Radio 1090, FM 101.5, and the WBAL mobile app.
Well, Brian Neiman, we're pleased right now to be joined by Dr. Anthony Chico. He is the Medical Director of Emergency Psychiatry at GBMC Healthcare. Dr. Chico, good morning to you.
Hi, good morning.
I want to ask you about the psychology in terms of parents talking to their children. We're now, 6 months or so into this, and, everybody's nerves are afraid. How do children keep communicating about COVID-19, this new reality, to their children?
Well, I think as we're approaching the idea of going back to school soon, I think first and foremost as parents, it's important that we try to maintain a positive tone, a hopeful stance, keeping in mind that the negativity that we express about maybe some of the shortcomings of the upcoming school year will become infectious, and it really can take away from the enthusiasm, especially our younger children will have about starting the school year.
Is there something that parents should be doing for their kids to make it easier for them to do the e-learning? And I know that's an open-ended question, but I'm just looking for any kind of advice, doctor, at this point, because I got three of them.
I'm a parent myself of a couple high schoolers, and I'm thinking of these questions myself. I think it's important as we think about the schools our children are going back to see, are they thinking about providing some academic support? Are there going to be some teacher virtual hours that will maybe complement the lesson plans? I know some communities, they're thinking about setting up some study groups or collaborate with friends. But I think we have to appreciate that aside from the academic part of all this, school provides so much more different types of learning involving socialization, problem-solving skills, a way where a child begins to assert independence. And those areas, that's my concern as a psychiatrist is, the academic stuff we can muddle through and we can find supplemental material through YouTube and other modalities. But, how can we continue to allow our child to grow as a whole person? I think that's what the virtual world is right now lacking.
Dr. Anthony Chico is on board with us. He is Emergency Psychiatry Medical Director at GBMC Healthcare. Dr. Chico, when it comes to, a lot of us think that children can't wait to get back to school. Eventually they're going to go back in. But I'm sure there's some children that are just afraid to either go back, whatever, from the things they're hearing about COVID-19. How do parents deal with apprehension or fear of children going back to school?
Well, I think it's important for younger children to be very direct and clear with them that we are making progress. Scientists, doctors are learning more about how this germ behaves. We're developing medicines, vaccines, and strategies of how to work around it or hopefully eradicate it. I think when we talk about wearing a mask can be a positive thing for a child as a symbol of control, as a way to say to the child, this is how you can help others and this is how you can help yourself. So trying to use these methods as ways to help the child feel empowered, not to be fearful of it.
Unfortunately, because we're supposed to stay inside as much as we possibly can, a lot of kids are spending time playing video games and they're on their electronic devices. You want them to go outside and play with their friends, but
Sure.
They're really not supposed to do that. So How do you get them outside or get them off of the devices as much as you possibly can and have them not be bored out of their minds?
Well, I think as families we have to be deliberate. We have to say, tomorrow at this time we're going to, go for a walk, or we're going to take the dog out, or, you're going to help me mow the lawn. I think we have to be more purposeful with our time to build that in. And again, I have similar challenges in my own home, just making sure that there's some diversity to our day. I wish there was an easy, quick trick there, but
it's not simple.
I would send them over to your house if I could, but
there you go.
Supposed to.
Well, Dr. Chico, let me ask you this. When it comes to a lot of parents, like I know my children, Brian knows his, I'm sure you know yours, but it comes a point where they really need some outside help. How do we, get to that point where we say, okay, we've done what we can do, let's reach out?
Yeah, no, I think you make a great point. Number one, you have to appreciate that you're the expert on your child. No one knows your child better than you. So if you see your child for a prolonged period of time where their sleep patterns are changing, their appetite's changing, they're becoming more apathetic, there's mood changes that are just uncommon, I think first you talk to your child. You point out what you observe and see if they've recognized those changes. Secondly, I think maybe we reach out to a familiar person in their life, a primary care doctor that you feel comfortable with, and then from there, possibly looking at more specialized care if need be.
Very good. Doctor, great to have you
Thank
on.
you,
We
Dr.
really
Chico.
appreciate you coming on the show.
Sure. Thank you all. I appreciate it.
Dr. Anthony Chico is the medical director of emergency psychiatry at GBMC. And
Normality
it
is the
deal.
best thing for them. Getting back to normal is the best thing psychologically for them, Brian.